The Pediatric and Congenital Cardiology clinics at the University of Alabama at Birmingham and Children's of Alabama are constantly seeking ways to deliver quality evaluation and care for those with congenital heart disease. They have reached out to our team, Dr. Chickens, given our extensive knowledge regarding both therapy and Wells models of constraints, to create methods that are effective and considerate of the motor development of the children with CHD. We will introduce, explain, and give examples of how to apply Newell's model of constraints to improve the efficiency and quality of care given by you. The physical therapies at the Pediatric and Congenital Cardiology clinics.
Newell's model of constraints demonstrates the impact of three factors: individual, environmental, and physical constraints on one's movement. Constraints can discourage or limit certain movements or encourage or permit other movements. In short, they work together to shape movement. Individual constraints are either structural in nature, relating to one's build, such as height, weight, and muscle mass, or functional, relating to behavior and motivation. Environmental constraints are related to the properties of the environment. They include physical constraints, such as gravity or the surfaces that the task is being performed on, and sociocultural constraints, which include gender roles or cultural norms. Task constraints are external. They're not related to an individual. They are related to a task or a skill that it is being performed. They include goals of a task, rules guiding task performance, and equipment being used.
Newell's model of constraints is relevant to the pediatric and congenital cardiology clinics as it helps you understand and implement different constraints during treatment so that patients receive personalized care that is conscious of their unique needs and circumstances.
So what are some examples of constraints observed in cardiac rehabilitation? In terms of individual structural constraints, we know that children with congenital heart defects have an abnormally developed heart or large blood vessels with missing or faulty structures. These children are often more thin due to less muscle mass, smaller in height and weight, and reach developmental milestones more slowly than other children. Functionally, they tire more easily when exercising due to improper blood flow and thus may lack the motivation to perform physical activities. Some children may have impaired cognitive function, so when designing a treatment plan, it is important to keep the parents educated so that they can help guide their children as they perform stretches and exercises until the child reaches understanding.
Two types of environmental constraints are physical and sociocultural. Physical environmental constraints involve the facilities where therapy is taking place. Smooth, flat surfaces are ideal for performing movements with ease, especially in regards to moving with a wheelchair or walker. Avoid lights that are too bright and maintain temperatures that are conducive to the child's performance. Being surrounded by too many people at a time may be overstimulating for some children, so we can avoid distractions and anxiety by being mindful of those individual limitations. Every individual has different strengths and limitations, and being mindful of these constraints helps you as a therapist create a personalized plan of treatment that will best address the needs of the child. From a sociocultural perspective, it can be noted that children with a chronic medical condition such as CHD may have parents that perceive them as vulnerable and are thus more hesitant to allow their children to engage in physical activities. We can thus work to correct this constraint by educating the parents on the physical and psychological benefits of light exercises so that they can acquire a positive outlook that fosters the child's participation in development.
Task constraints in cardiac rehabilitation include the types of physical activity performed, such as stretches, aerobic exercise, and resisted training, that are implemented depending on the child's individual constraints. For example, if the child struggles with debilitation, we first use equipment such as wheelchair and focus on the upper body strength, doing range of motion exercises such as a yoga ball exercise to improve flexibility or arm cycling to improve aerobic capacity. They can then progress to using a platform walker or a treadmill to improve motor skills necessary for walking. When engaging in physical activities, it is important to control the intensity of the activity given that many children with CHD fatigue easily. Depending on individual restrictions, exercise may need to be light enough where the child can still carry on a conversation with the therapist.
Exercise is beneficial for children with CHD because it lowers the risk of obesity and cardiovascular disease, which are prevalent among those with CHD due to sedentary lifestyles. Physical activity improves cardiovascular and musculoskeletal fitness, motor skills, and self-esteem.
One of the exercises that I mentioned earlier was a yoga ball exercise for the upper body. So the exercise is basically the PT, this gets me, would be holding the patient's body so it's stabilized on the ball, and the patient would be touching their ears with every arm, with alternating every arm, like this. We can do several reps with each arm and then stop, and then do a certain number of series of the same exercise.
Our team is here as a resource to enhance your understanding of Newell's models of constraints. When it comes to implementing anything new into a program, knowledge of what is going on is key. If you are confused on a certain constraint or how to identify and work with a constraint, we can answer any of your questions and assist you in your endeavors. Best regards, and thanks for watching.